Pink, 105.1 The Buzz. Dari Ted here. Welcome to the show, our friend and cosmetic surgeon, Dr. Michael Workman.
Yay!
Hello.
So Dr. Workman came and visited me when I was in the hospital, and I was the thing I was in the hospital for was all these intestinal things, and then most of all my appendix. But it occurred to me after he left, I was quite high and also in in a bad state of depression. So I have some questions about guts.
Okay.
So I recently read a really good serial killer novel, and the guy's MO, which is kind of gross, was to slice open people, and he would bring out their guts. How hard is it to bring out the guts? Like when you're
the guts.
Are the guts are they just waiting to unravel, or are they held together by some sort of membrane? Because I know your intestines, they're something like 5 miles long.
I don't know they're 5 miles
and
long.
then they wind all around until they're this tight little bundle. And then if you but are they just if you pulled some by accident, would everything just come flying out?
It wouldn't come flying out, but they would naturally come out. I think what we normally do for abdominal surgery is we make a cut right down the middle through that piece of little fascia. Right underneath there's a little pocket of fat, and then you have the intestines.
Or a big pocket of fat.
Or a big pocket of fat, yeah, and you have the intestines. The intestines are held together by a thin little piece of tissue, but you can pull them out pretty doggone easy.
Hence The Walking Dead. You've seen that happen in The Walking Dead.
Yeah,
Yes.
and Walking Dead too.
Yeah. Because in Walking Dead, they'll cut the stomach and they just all fall out.
What would happen if you took them out partway and then you put them back together? You stuffed them back in wrong.
That would be bad. You could, it could lead to, you could get a infarction of the bowel if you twisted the
Your
bowel
mom's
on
an
itself.
My mom is an infarction of the bowel.
Yeah, or if you have sometimes you can have a problem with adhesions. Anything foreign that gets into that abdominal cavity can cause scar tissue later on
Like a
down the
Pez
road.
dispenser?
Yeah, I think that would qualify.
Yeah.
I think that would qualify.
When you
I think it
slice
would
open
too.
a human body,
Yes.
is there a smell?
Interesting.
Normally there isn't,
I think
unless
Mitch
there's an
protests too much.
infection. Yeah,
Unless
if there's an infection, it's like unbelievable.
So when Daria had her rotten appendix, I'm sure there was probably an odor.
Yeah, it was full of gangrene, so it probably smelled like a rotting corpse.
Yeah.
A tiny one. It's only the size of your little finger.
Yeah.
It would be like a Tinkerbell corpse.
Okay, that's not so bad.
Yeah.
I mean, there's times we have
Tom
to
Thumb.
take
in my
alcohol
body.
on top of our masks and soak it because the stench is so bad, especially with infarcted
Wrongful
bowel.
death.
Yeah, wrongful death.
So here's my question.
Okay.
That actually has something to do with what you do. If you're doing a tummy tuck, you're doing a tummy tuck, how do you ensure that, because that's going to corset the waistline, the area between the rib cage and the hips, that's going to tuck that in. So how do you make sure you're not putting too much pressure on the carefully woven guts?
That is an excellent question.
Thank
Yay,
you.
Daria,
Excellent
you're the
question.
best.
Yes, because it has happened in the medical literature where people have tightened up the muscles too much, like putting on a corset at Thanksgiving, such that the lungs could not fully expand, and a person went into pulmonary failure a couple of days afterwards. So what we do is, number one, you go to somebody who's done this a lot, and you just know. But number two, I have the anesthesiologist monitor how much air pressure is coming into the anesthesia machine. So if they're finding out that, the anesthesiologist can tell you if there's increased pressure on the lungs.
I see.
That being
Brilliant.
said, I'd suffer a little shortness of breath to have a waistline like Raquel Welch. I don't know how she ever took a dump.
I don't
her
know
waistline
either.
was like 13 inches and her hips were 40.
I know.
It doesn't make sense, does it?
Besides tummy tucks, Dr. Michael Workman also performs more breast augmentations than any other plastic surgeon in the Pacific Northwest. Basically, everything from the neck on down is his specialty.
He's your man.
You can visit his website at drmichaelworkman.com. Thank you, Doc. And all of the listeners, please wish a happy birthday to the beautiful Mrs. Workman, who's going to have what do you call it? What's it called when it's a big birthday? An important
birthday.
Milestone.
A milestone
A
birthday.
milestone birthday, yes.
Yeah, on
yes.
Friday, and we love her very
She's
much.
the best.
Well, thank
and
you.
we love you too.
Well, thanks so much.
See you soon.
Bye.
Leif's Auto Center.